Thank you for the opportunity to share some of our ongoing research on the COVID-19 pandemic and the associated global economic slowdown that it has triggered. This is part of policy research and monitoring by the Ateneo Policy Center, and it draws on the latest available evidence and information on these twin crises. This presentation tries to tie together the social, economic, and political implications of the pandemic. The key policy messages of this presentation are as follows. First, inequality tends to frustrate COVID-19 responses and raises the risk of non-inclusive recovery. Second, non-inclusive recovery from COVID-19 can exacerbate long-term inequality. Crises can potentially become inequality machines. Third, without inclusive recovery, deeper inequality could lead to more populism, weak institutions, and bad governance. Let me begin by first emphasizing that some of the main responses to COVID-19, such as lockdown and mobility restrictions, have precipitated what could be one of the deepest economic recessions in recent history. These initial responses are best seen as means for countries to buy time for their health, social protection, and test, trace, treat systems to catch up with the disease. The best indicator of success of systems here is when the epidemiological curve is flattened. Just to illustrate, you can see this in the figure of the epidemiological curve, whose peak at 1A is flattened to a peak of 1B. So this is the curve here, and that's the peak 1A, which we are trying to flatten to 1B. And 1B should ideally be close to the maximum absorptive capacity of the national health system, which is the red line in the figure. Put simply, all COVID-19 cases can be absorbed and managed well by the system as long as the number of cases don't breach the red line. However, lockdown is an unsustainable strategy since the cost of lockdown becomes higher over time. When prolonged, it increases the risk of a deep recession. Once systems have caught up and flattened the curve, lockdowns can and should be relaxed in order to allow the economy to recover. In the figure, this relaxation of the lockdown is represented by the area between 2B and 2C. So that's the area here. As we have flattened the curve, the economy, total GDP has gone down. But once we begin to relax the lockdown and the mobility constraints, the economy could then be allowed to recover and reach the point 2C. And this is the period where we presume that trust in stronger healthcare systems would be paramount and that test, trace, and treat systems are already in place to prevent another flare-up of the disease. The stability of this recovery depends on many factors, but key ingredients include strong healthcare and test, trace, treat systems so that all economic actors trust that the risk of another outbreak has been minimized. Hence, attempts by most countries to flatten the curve necessarily cause their economies to slow down. COVID-19 has affected well over 200 countries and territories, including most of the richest countries and emerging market economies, accounting for much of global income and growth. Initial projections by the World Bank suggest that the global economy will contract around 5% in 2020. This is a significant contraction. If it happens, it will be the deepest global recession since World War II. When reviewing a data set of global economic recessions between 1875 and 2020, the recession forecasted in 2020 is expected to be unique in the sheer number of economies involved. Well over 90% of all countries are expected to contract in 2020. So this is the figure here in terms of the number of economies involved. And the World Bank forecasts that the global recession in 2020 will be historically quite significant because it is the global recession with the most number of countries involved since the 1870s. With the global slowdown, the World Bank also projects that around 176 million people will fall into poverty, where the poverty line is $3.20 a day using 2011 PPP. With contracting incomes and greater poverty, hunger is also expected to increase dramatically. UN agencies project that around 83 million to 132 million people could go hungry in 2020. Pre-existing hunger and malnutrition prior to COVID-19 put many countries in a highly vulnerable situation under pandemic conditions. Asia alone already has about 381 million undernourished even prior to COVID-19. And based on a study of remittances by the World Bank, COVID-19 is expected to affect both remittance sending and remittance receiving countries. Hence, the countercyclical buffer usually provided by remittance flows could be absent in 2020. For a country like the Philippines, which has usually weathered previous crises due to strong remittances, this is not necessarily present this time around. And in fact, the World Bank forecasts that many regions in the world will suffer from a dramatic contraction in remittances. Turning to a historical snapshot of the Philippine economy, COVID-19 has put a stop to 84 quarters of growth that used to distinguish the Philippines as an emerging market economy. The second quarter growth figure for 2020 was minus 16.5%, which pushed the country into technical recession. As mentioned earlier, this economic contraction is the price we pay for buying our healthcare and social protection systems time to respond to COVID-19 more effectively. Unfortunately, there is little evidence of this effectiveness so far, as cases in the Philippines have continued to increase. And even as the country is one of the worst economic performers in the second quarter of 2020, it also posted one of the highest number of COVID-19 cases in the region, overtaking Indonesia in number of cases in early August 2020. The lockdown cost the Philippines around 18 billion pesos in lost output per day based on unofficial estimates. And according to a survey by DTI, in June, around 1/4 of firms surveyed had to close down. DOLE forecasted that up to 10 million workers will lose their jobs due to COVID-19. And recently, SWS released a report that due to COVID-19, an additional 5 million families experienced hunger during the lockdown period. Finally, PIDS, the country's top development think tank, also released a study recently that forecasted up to 1.5 million Filipinos sliding back into poverty due to the COVID-19 pandemic. I would like to warn you that the next images are rather graphic, and they are part of anecdotal evidence on the severe challenges faced by many Filipinos because of the COVID-19 pandemic, the lockdown, and the ineffectiveness of our efforts to provide inclusive healthcare and better control of the disease. These are images from a media report of a Filipino who passed away the day before because of mysterious causes. And this is in a densely populated community here in Metro Manila. These are anecdotal reports from many communities that COVID-19 goes undetected and unreported, raising the risk that these densely populated areas can become areas for the flare-up of the disease. Among the key issues most analysts point to are pre-existing conditions of poverty and inequality that tend to frustrate crisis response. These include weak access to clean water in some areas, population density, weak urban and transport planning, weak access to healthcare and weak health-seeking behavior, some social insurance but focused on the existing poor and not the new poor connectivity, and disinformation and division. The short of it is that our health system doesn't appear any stronger despite the time provided by one of the strictest and longest lockdowns in the world. The emerging evidence suggests our healthcare system was near breaking point several times already. As early as May, private hospitals warned that many were on the brink of closure because of the high costs of treating COVID-19, the depressed revenues from other healthcare services, because as you recall, there was a chilling effect on health seeking as many patients feared contracting COVID-19 in the hospitals, and the delays in collecting from PhilHealth. Later, we would find out that PhilHealth would face corruption allegations that further raised uncertainty in the healthcare system's stability. Health workers did not feel amply protected and adequately compensated for the risks that they faced. And anecdotal evidence of demonstrations and numerous complaints added to the uncertainty, despite DOH opening many nursing positions, very few have signed up so far. And to top it off, DOH still has data issues, exposing serious gaps in information despite being on various phases of lockdown since mid-March 2020. And here, to be fair, the DOH has been improving, but the question is whether the improvement is significant and timely. And this is a quote from a recent report on the DOH, wherein it released one of the highest numbers of deaths related to COVID-19 very, very recently. And the data shows that some of the deaths actually took place months ago, only now being reported and included in the data set. In terms of social protection system, it's not clear whether the safety net offered to those in need right now is sufficient. The image of a poor barangay under lockdown in Cebu paints a picture of our quandary. So this is an image of this barangay where we had a COVID-19 flare-up, and some of the community members shared this poster in front of their community. And let me quote here, "If you cannot feed us, free us. The spread of COVID-19 is not our fault. Stop the discrimination." So I believe this actually captures well some of the sentiments of different communities and different stakeholders and advocates in terms of properly providing support and social protection to communities under lockdown. The government has also admitted recently that lockdown with ample social protection is no longer quite feasible, likely because lockdown threatens to deplete economic activity and ultimately tax revenues. Unsurprising then that more and more analysts are now recognizing the shortcomings in leadership and crisis management in the Philippines. In July, ING expected the Philippines will not post a V-shaped recovery, contrary to the claims of some economic officials. In August, Fitch Ratings noted that the Philippines is eroding its ratings buffers and therefore raised some red flags already. And in early September, Global Source revised down its growth projection for the Philippines to minus 8.5% for 2020. Many analysts now believe the Philippines may resort to intermittent bouts of lockdown just to prevent its health system from being overwhelmed. The mere expectation of this will surely exacerbate the chilling effect on growth and investment prospects for the country. The failure to tame COVID-19 and the high risk of protracted crisis and uneven recovery raises the risk of higher inequality as a result of this crisis. There are several points to consider here, and I will elaborate on them. First, in terms of the labor sector, we know that 2 billion people across the world work in the informal economy, where there is very little formal protection during a crisis. And in the Philippines, some 16 million workers fall into this category. Unlike those of us who have the benefit of continuing income streams and work from home arrangements, many workers will be displaced and in need of reskilling in order to transfer to other opportunities. This is where the private sector can play a very important role, since international evidence shows that transition is more effective if the private sector is involved. Furthermore, as regards education, while some children and young people will be able to transition to online education, millions will not be so lucky. The digital divide is similar to the worker situation, a separation of adaptive capabilities between the technology haves and the technology have-nots. There is now growing concern over a lost generation whose human capital will suffer during the crisis, and some may permanently fall through the cracks of the social safety net. Here, both public and private sector innovations could play a role in helping to bridge the last mile to provide a lifeline for these students. Some investments in connectivity will be critical. Hence, there is a risk that crises can become inequality machines, my point earlier. This quote by Damien Barr, a columnist for The Guardian, frames the inequality risk quite well. We are not all in the same boat We are all in the same storm. Some are in super yachts, some have just the one oar. So this highlights that even as we all face the same crisis, not everyone's adaptiveness to this new normal is strong. And in fact, there could be a wide divergence of outcomes based on the different degrees of resilience and adaptiveness of communities, individuals, and sectors. Let me now begin to tie together the socioeconomic implications of the crisis, which we just reviewed, along with the political ramifications of mishandling COVID-19. First, it is critical to note that many countries were already reeling from a populist wave prior to COVID-19. The timing of COVID-19 could not have come any worse. The international evidence suggests that more unequal countries tend to be more protectionist and also become more susceptible to a strongman rule. Hence, we have an emerging hypothesis of crisis links with the political sphere. Let me show you here the emerging hypothesis that we have. First, populism is associated with weak institutions and weak social cohesion. Many populists use divisive rhetoric, fail to acknowledge science and evidence, and also promote or at least tolerate disinformation. All these factors likely frustrate crisis response effectiveness. This can then lead to uneven recovery, in turn, a higher risk of inequality. Structural inequality in turn could infect the political sphere yet again, feeding into a higher risk of populism in the longer run. Hence, the concern that crises could become inequality machines and could feed into populist tendencies in the longer run. Evidence of populist tendencies are especially apparent in government messaging on the crisis. Some senior officials blame the spread of COVID-19 on undisciplined Filipinos, mga pasaway. Even technocrats in charge of complex systems that should be driven by science and evidence seem to pin instead the blame on weak systems, the blame not on weak systems, but on the lack of discipline. This appears to shirk from their accountability for having failed to set up test, trace, and treat systems and stronger healthcare. Yet other leaders even suggest a shame campaign against those Filipinos who don't comply with the lockdown. This is unfortunate because that strategy will likely exacerbate division and stigmatize the disease, further driving it into the shadows unreported and raising the risk of spreading it undetected. Yet, the emerging evidence suggests that Filipinos did comply with mobility restrictions, and even for those who failed to comply, it was not because of lack of discipline, but because of a lack of social safety nets, so they could avoid hunger while complying with the lockdown. Fortunately, some leaders are stepping up to speak in defense of their constituents and emphasize the positive reinforcement that the state could provide. In the words of one mayor, the enemy is the virus, not the people. Finally, as a point of pride, let me share that one of our graduates in the Ateneo School of Government, now mayor of Pasig City, demonstrated the type of innovative servant leadership that builds on social cohesion by bringing the private sector in to help find solutions to crisis challenges. Here, he partnered with a private company to integrate tricycle drivers, some of his constituents, into the online supply chain, which is now thriving in the new normal. Just a short note here on the importance of stimulating inclusive recoveries, and since Bayanihan 2 has recently been signed into law. Due to a lack of time, I cannot review all of the elements of Bayanihan 2, but suffice to say that it has some useful elements to strengthen reskilling by workers, support for SMEs, protection of health workers, support for test, trace, treat systems, and safety nets for displaced workers, OFWs, and other vulnerable groups. It is also important elements to support local manufacturing, which is important in case international supply chains are disrupted. Yet one key concern could be whether it is sufficient. Based on different projections, the economy could contract by around 1 to 2 trillion pesos in 2020, and it's not clear whether Bayanihan 2 is going to be enough. Clearly, what this suggests is that another main battlefront for inclusive recovery is the main budget for 2021. Now, let me end by outlining some of the key components for effective crisis response and inclusive recovery based on the emerging evidence on international good practices. First, technology is critical, and this crisis is likely going to change our notion of connectivity as a national public good rather than a service that only a few can afford. Second, the crisis highlights the deep need for institutions that build and strengthen trust. This is possible in an environment that provides positive reinforcement of collective action and reinforces social cohesion and counteracts discrimination. Finally, we need to transform the health sector from the present brick and mortar system, which is costly and is probably associated with high risk of infection, to a more technology equipped system that puts a premium on inclusion, early detection, and strong underpinning for healthy communities with strong access to public services and utilities. Let me end by stating that in the final analysis, countries with less poverty and less inequality, and with more inclusive education, healthcare, and social protection, are much more likely to stand resilient against pandemics, such as the one caused by COVID-19. Thank you very much for taking the time to listen to this presentation. I look forward to our exchange.